We are structuring this session today as you might have noticed, the session is being recorded for those who can't join right now. We have two speakers today who will present some projects in Latin America that have an outcome focus and yet are not impact bonds. So it's a bit different from the instrument we usually cover, but hopefully there is a lot to learn, especially on the data aspects, like what variables should we collect about this project and how can we facilitate some cross-learning. The speakers who I will introduce in a minute will be supported through discussion by a discussant. But before we go inside the session with all our speakers and me introducing them, I would like to take a few minutes for Juliana to update us on INDIGO and what has happened since we last met. Juliana, over to you.
Thanks, Mara. So I have a couple of INDIGO updates to share with you. The first one is that our dataset has 250 impact bonds now, which is a great number. And as you also can see, our map has now a new look and feel. And this is because a common problem among the INDIGO community was that our usual map was counting service delivery locations. So every pin in this map would count a service delivery location of one impact bond project. People felt that they wanted to have a different tool that would enable them to count the number of impact bond projects. So that is why we included this new choropleth map. This is a bit different. This map is counting number of impact bond projects per country. And the only thing you need to do is to hover over a country and click on that country to see how many projects are being delivered in that region or that place. And my final update is that we co-authored this blog with Hack and Learn participants. This blog is about our reflections from our last Hack and Learn, and it is also a good excuse for us to read and to get excited about our new Hack and Learn, which is going to be in the summer. And this time we want to kick off our event at the Social Outcomes Conference in September 2022, and we want to work during September. So we're going to start thinking of challenges in the next weeks, and this is an invitation for everybody to be part of the event. And this is also an invitation to share feedback and to share ideas if you have some ideas about potential challenges that we could be working on in the future. Those are all my updates. So it's back to Mara now.
Thank you, Juliana. So here we are. Please feel free to drop a line in the chat to introduce yourself and saying where you're calling from. On stage today, we have three speakers, as I mentioned. We have Sigrid with us today, who is a partner and a founding member of INDIGO. At INDIGO, she's directing all the Latin American strategy and the operations in the region for INDIGO. She provides technical strategic advice on various projects on a global scale. To give you an example of what Sigrid does, she has been working on the first social impact bond that was ever implemented in a low and middle income country, in the first outcome fund in Africa, and in performance-based grants as big as the $300 million in Egypt. So lots of experience, lots of insight to share with us. And she covered many sectors, so education, poverty alleviation, early child development, workforce, and environment, health, governance. And she's been an advisor to different players, from government to foundations, not-for-profit, and international organizations like the World Bank or the Inter-American Development Bank, as many others. Next to her, as a speaker, we have Martin, who is a health financing expert. In his career, he has been the deputy minister of the National Ministry of Health in Argentina since the end of 2019 until the beginning of 2021. He currently is also a senior advisor for the Inter-American Development Bank and the consultant for the Department of Health System Governance and Financing at the WHO on reforming health system and intergovernmental transfer and strategic health. He was the mastermind and the former CEO of Plan Nacer in Argentina, and he will talk to us about it today. Recently, he has also provided technical assistance in health financing in more than 20 countries from all over the world: Uruguay, Mexico, Peru, Colombia, Panama, Honduras, among many others. So we have lots of experience on stage, and to steer the conversation, we have invited Malala, who will be the discussant. Malala is the director and founder of Acrux Partners, which is an impact investment intermediary and a market developer who focuses on South America. She is the founder and the head of the Impact Investment National Advisory Board for Argentina, Uruguay, and Paraguay. She's also in the investment committee for NXTP, Impact Investing Fund in Latin America. So what I ask our speaker to prepare for today are two things. First, I asked them to look at, to tell us how these outcome mechanisms work on the project they are presenting. And as I said earlier, for those who join later, those are projects that are different from social impact bonds, but still tie payment to outcome. So what is the core mechanism? Question number one. And question number two, given this is an INDIGO session, we look at the data angle. If we want to create a more comprehensive data set and facilitate cross-fertilization of idea and development of insights across projects that link out payments to outcome, what are the key variables and data that we should really collect on these projects? So with no further ado, I'll stop here. I'll hand over the microphone to Sigrid from INDIGO to present on the project that she selected for us today. And I understand she wishes to focus on a project from Peru. Sigrid, over to you.
Thank you, Mara, and thank you for the invitation. It is a pleasure to be here. And maybe I'll start with a brief introduction about INDIGO for those who don't know us. We're a nonprofit organization that started working 10 years ago to bring impact bonds, result-based financing mechanisms, to developing countries. We started working in Colombia when no one else was talking about SIPs in the country, and we are very happy to have launched the first social impact bond in a developing country, as well as the first DIB and outcomes fund that is hosted in government in a low and middle income country. And since then, we have worked in more than 100 result-based financing projects in many different regions. And specifically in Latin America, we have worked in around 13 countries with more or less 20 government entities, helping them tie funding to results, and a larger number of international organizations like bilateral, multilateral organizations, foundations, and many others. I wanted to start, before diving into the example, mentioning that in Latin America, we have launched 5 impact bonds and an outcomes fund. And this experience has been really impactful and really interesting, especially from a change management perspective. However, in the past 5 years, we have come to realize that there are larger scale moves that are necessary in the region, given the size, the scale of the needs, and also the funds that are invested, used by governments on a yearly basis in the region, right? So that's why we started working with a range of result-based financing mechanisms beyond impact bonds, which we can classify more or less 2 types. One is helping governments and other organizations transform how they procure services, right? So how can they contract organizations with a focus on results, right? Like paying for outcomes, for results. And the other one, the other big category is like how can government increase the effectiveness of their direct service delivery by using incentives, by transferring funds to other government entities, conditional on outcomes and on results. And yeah, so in the region, we have worked with several actors. We have tied or helped tie around $100 million to results in Latin America, serving around 10 million beneficiaries. So just to give you a sense of the scale of these mechanisms as compared with impact bonds. And I also wanted to mention that there's like many actors that are using these tools. In terms of government entities, I wanted to highlight 2 countries where we see a growing use of these mechanisms. One is, of course, Colombia, where besides the growing use of impact bonds, we also see a growing use of performance-based contracts. There are these mechanisms that are not impact bonds, right? So we see very distracting. Yes, so I will say that in the case of Peru, like the government has used many different performance-based transfer mechanisms, also in different sectors, to incentivize regional and local governments, as well as other public organizations such as public universities and others. Yes, and in terms of like donors, as I was saying, like there is like many donors that are using RBF for dispersing their own funds or supporting government to use RBF tools. And so, for example, USAID, the Swiss Corporation, the Canadians, the Global Fund, the EU, and yeah, the IDB, the World Bank, and many others. Now, in terms of examples, I just wanted to give a really small explanation of one project that we have in Colombia, where we are helping the mayor's office to hire, or like to hire different contractors based on results, to place 45,000 people in formal jobs for around $11 million. So just to give you a sense of like the difference in terms of scale between the impact bonds that have been implemented in the same sector, where like the investments or like the total amount of funds tied to results is around $1 million with a smaller, significantly smaller number of beneficiaries. So that I think is a really interesting example of how these mechanisms have evolved in the country from small impact bonds to large scale procurement reforms for, yes, like serving significantly more beneficiaries. And now going into the example of Peru, where we have the slides here, I wanted to talk about an initiative of the Ministry of Education. And just to give you a little bit of context, the education in Peru is decentralized. So for many years, the Ministry of Education has devolved the responsibilities and funds for education services to regional governments. And this, paired with the historically low quality of education in the country, has caused that some key results like learning outcomes in terms of math or reading comprehension have been quite low. Education decided to create an initiative in which they were going to transfer funds to around 250 regional education divisions in the country, which are all regional education divisions that are in charge of education based on results. And this is an additional pot of money from the regular budgets of these units, because of course they cannot put the funds that they need for service delivery at risk. So this is an additional pot of money, and as I was mentioning, conditional on results. We helped the ministry in 2016 to redesign the program to make it more catalytic. So some of the things that we redesigned were the indicators that were going to be incentivized. So to give you an idea of which indicators are generally used for this program, one of them is learning gains, both in reading comprehension and math. And then also the attendance of students, teachers and principals to schools, and then some of the services that subnational governments provide to schools, such as adequate learning materials being delivered to schools on time, or paying for utility services on time as well. And we also included a satisfaction survey of schools rating the services, the quality of services of regional governments. And this mechanism is quite complex, as you can imagine, because there is like more than 250 units of government that are incentivized, covering all the around 6 million students in the country. The verification mechanism that is used is based on administrative data from the government. They have many very robust tools, such as surveys that they do on a representative sample of schools on a monthly basis. So we also help the government increase the quality of the verification mechanisms that they use, and also in setting targets, which is quite complex in an environment where you have such a high heterogeneity of results, right? As you can imagine, from the large capital with a high capacity and large amount of resources to small units in very isolated areas, right? So setting targets is also a big challenge in this type of context. But as you can see in the next slide, this has been a program that has been implemented for around 8 years, and it has been quite successful. We have seen, as part of the work that we did with the ministry, that practices in subnational governments have changed significantly, right? In some places, and like according to the needs, right? There's no prescribed way of supporting subnational governments. There's of course some capacity building, but what we see is that they also improve the processes they use for managing the performance of the regions. Sometimes they hire specific people that have a profile to help them make sure that they're meeting the targets, so they're course correcting and they're improving. And there is an evaluation, we didn't do it, but it's an evaluation that measures the impact of the program, and it showed very promising results, such as increases in math and reading scores in 17 and 10% respectively. And yes, this has been a successful program. It has disbursed around $200 million. And it has been going on and improving over time, despite of multiple changes in administrations in the country and in the ministry specifically. And it has also led to additional result-based financing mechanisms being implemented in the ministry. So besides this program that is incentivizing regional governments, we also have programs that incentivize public universities or schools and many others, which talks about like the power and how beneficial this program has been for the ministry. Yes, so like that's about the program. And yes, I really wanted to just close this by mentioning that the discussions many times focus on how do we bring more funds, right, to developing countries for closing gaps and the needs of yes, the beneficiaries in these regions. However, we do believe that there is a lot of potential in like closing these effectiveness gaps that we see in like the trillions of dollars that are spent annually by country governments by using new and performance-based mechanisms to both procure and transfer funds. And yes, it's really encouraging that there's many examples of success cases in the region. Yes, and then in terms of the data aspect, I think there's like many variables that are extremely useful that you're already collecting in the impact bond database. Maybe something that I would like to see that I don't know if it's not that easy, I guess, to include, but in terms of like expanding the use of these tools with quality, I think it would be really useful to include perhaps links, but for like some evaluations that are being developed on these mechanisms, right? Like not many of them have evaluations that show if they were successful or not, but there are some, and there is no current platform to actually like make them very visible and like easy to find for people in government and other actors that are interested in these mechanisms in the space. And I think that will be really catalytic because as we know, changing practices in such a significant way, like using these tools, is very hard, especially for government entities. So the more information there is about like, what has been done in the past, who have been the actors involved, and what has been the focus, but also if they have been successful or not, I think it would be really, really useful.
Great. Is this okay? I didn't know if you had finished, Sigrid, because the connection was cutting up. Thank you so much for introducing us to another way of doing outcome payments in Latin America. We're used to talking a lot about SIPs and DIPs, but not so much about other ways in which we can use the tool to work with governments or others. In terms of your experience, because INDIGO has a variety of experiences, not only with using, for example, a grants-based mechanism for outcome payments, like the example you described for Peru, but you've also been heavily involved in the design of SIPs in Colombia and other countries. Given the context in Latin America and given the resource constraints that governments many times face, given the incipient level of development of the impact investment market in Latin America. Would you say that adapting the tool to something like you've just described for Peru and other cases that we can find in the region, and we're going to hear from Plan Nacer in a few minutes from Martin, would you say that that works better for a context such as the Latin American one, as opposed to a more complex version of outcome payments, which is the SIBs, where you need to involve private sector investors that will sort of cover part of the costs whilst the service providers are doing their work?
Yes, so for me, like these tools are tackling different needs, right? But in terms of your question, if it's like more promising to think of additional mechanisms, I think probably yes, in terms of like the needs, in terms of scale, right? Like of the governments, like many times we talk about impact bonds and we know that the scale of these programs are generally quite small. And it's again, very interesting. And from a change management perspective, it can cause really big differences, right? In like how governments procure services, it can show how government and other actors like the private sector can collaborate really well. However, this is generally not that attractive, right, or useful for governments when they need to provide like change results for millions of beneficiaries, right, which is something that is not necessarily best suited for an instrument like an impact bond that, as you said, can be quite complex, that involves additional pots of money from investors that might not have the same scale of reach as governments, right? So for me, that's why like these instruments can get us to larger scale moves. And we've seen it, right? As I was mentioning in Colombia, this natural kind of trend that we are seeing, that we started working with impact bonds. Again, very interesting, great results. We've seen more and more of this, right? So we have already 5 in the country. But in terms of like the 6th one, like the next contract program where we were working, and we are working with the mayor office in Bogota, they were very interested in scale, right? They wanted to place 45,000 people, and like the other impact bonds were placing less than 1,000 or around 1,000. So we needed to think of an instrument that adapts to this reality and these needs. And that is why this program has been really successful in that way, right? Like adapting the tool, adapting the model to make sure that it reaches that, yes, covers the needs of government, but it's also something feasible for the private sector, right? We cannot obviously transfer 100% of the risk to service providers as we do in impact bonds, but finding what is reasonable, feasible, and attractive for service providers is really interesting. And this is just one example, right? But now we're working with ECD government entities and others, and like our focus currently is more on performance-based contracts than impact bonds.
And related to the point that you mentioned on scale, because that was one of my other questions, is indeed, if we do a SIB, usually in Latin America, what has been done, it's been pilots in order to then give it to the government, so give the results to the government so that the government can scale. But it's proving extremely difficult to scale because you cannot sort of download all the responsibility for financing on the private sector, or at least not yet in Latin America. Because the system is not yet fully proven, and because there's, as I said before, there's not such a big market in terms of impact investment yet. What you've described for Peru, which has also been described for other cases where we use grants, either grants-based outcome financing, or where the government is scaling results-based financing through existing programs, is based on the incentive angle. So it's the government will pay for all the costs of education in the case of Peru, and on top it will add 138 million of incentives. Do you see that the region is ready in the cases where this tool has been tested already to incorporate not only an incentive mechanism, but also a sort of a punishment mechanisms if they don't achieve certain results? So a withdrawal from some of the funding that they receive, or do you see that that's not feasible in a region, especially if it's being funded 100% by the government?
Yes, that's a good question, and it varies, right, depending on the enabling environment of different countries. So there are some countries where like the technical, the administrative, and the political conditions are more ripe to use these tools, right? Where there's already examples and pilots that have been developed, right? So in the case of, I was mentioning Peru and Colombia, for example, these are countries where there is experience and there is a growing use of these tools. But then like it's not necessarily the case for other countries, right? So, and also like in the region, there's different levels of maturity, let's say in terms of like this enabling environments that I was talking about. So I guess in some countries, it could be really promising and really interesting to start piloting these mechanisms, because it's often the case that you start small, you pilot something, you prove that it works, and then, you know, over time it gets scaled. And in our experience, donors have a really key role to play, and they have been really useful in this sense, right, of bringing innovative tools for governments, because it's really hard for governments to innovate. And then there's other countries where this enabling environment is less mature, where perhaps trying to pilot RVF mechanisms from the outset is not necessarily the best step, but rather preparing, you know, the ground in terms of technical elements, such as, do you have even verification mechanisms that you can use within the government to understand what results you are achieving or not, right? Like, do you have the capacities in the government to understand what this entails? Like, do you have the procurement tools to start using these mechanisms? So I think it varies in different countries, but I think that like having or trying to use these performance-based decision-making practices is really useful, I would say, in all the countries of the region, perhaps with different mechanisms. But yeah.
And I think that there's a question in the chat from Mayra that aligns to the issue of scale and why, in your opinion, impact bonds remain small at present in Latin America, whilst other ways of doing outcome payment or using outcome payment mechanisms have been able to scale. What's your opinion on that?
Yeah, I mean, I think there's many reasons, but perhaps like two that we've seen very clearly in the last years is, one is like that timelines, right? The need to deliver quickly, right? For yesterday in governments, right? Governments don't have a lot of time to wait to show results and to implement programs. So the idea of implementing an impact bond, where, as we all know, like structuring these mechanisms takes some time, right? So at least 6 months in our experience in Colombia, that can be something that is not interesting for government, right? So like they're looking for ways in which they can react faster and show results faster. And also, as I was saying, the scale, right? Because as well, like doing something innovative can be interesting, right? And to pilot and show results, but over time, like they cannot be just piloting small scale programs. They need to significantly increase how they deliver services at like large a number of beneficiaries or like citizens. So impact bonds also have this difficulty in that they require this pre-funding from investors, right? So it doesn't only like make the process longer and more complicated, but also you need to be able to fundraise, let's say, for large amount of funds that might not be feasibly,
in the private sector.
In the private sector, right? And especially given the timelines. So I think like those are kind of like some interesting points. There's, I think, others, but yeah, I think these are the most salient.
Great. I'm going to tie my next question to one that it's in the chat from Jorge Ikawa. Jorge's question is relating to data and the availability of data. Data, as we know, is sort of the main and core element of outcome payments. It doesn't matter if you're doing a social impact bond or if you're doing outcome payments through a grants-based mechanism or through the government. But usually data, when we're talking about the government and we're talking about scale, it's either unavailable, or if it is available, they don't want to show it, or they don't want to portray as what the administration was doing before was wrong and more kids were dying or more kids were being not properly educated, as opposed to what's happening now. So there's the issue of data, and it's the issue of do they want to show the data? Do they want to share the data? And that's like an unavoidable fact of how difficult it is sometimes to structure these deals and structure them to scale. And tied to the issue of data, when we're looking at governments, and when we're looking at scaling through the government, like the example that you showed from Peru, is the issue of political cycles and administrative cycles for the government. It might be that one particular administration is keen to do this and try this, but that the impact that you're going to see through your outcome payment, if you really want to measure impact and if you really want to have that data, will occur in a different administration, maybe with a different political party. What's your experience on this? You've been in the region for long enough, so you've permeated through different government administrations, maybe with the same program, like the case of Peru. How do you circumvent that?
Yes, really good question. So in terms of data, of course, right, it is necessary and it is often a challenge. But what I would say is that I think it is a challenge, but not a barrier to start using these tools, right? Ideally, we would have a perfect data environment to then structure very sophisticated and specific programs. But that's not often the reality. And what we have seen is that, like, especially when you're piloting and using these tools for the first time, then it is okay to start with more assumptions, right? Like being more conservative on like how you structure these deals with low data environments, right? And this is feasible. Again, like you can think of using benchmarks from other countries, using information of how much the government used to spend, more or less how many results did they achieve, to try to do something that obviously is more cost effective, right? And more interesting for the government moving forward, but perhaps not with a perfect data environment. But then what we've seen is that these tools have actually had the benefit of helping build stronger data sets, right? So in many cases, the order has been kind of different, that we have started using these tools, and that has helped us build more robust data systems. So yeah, that's one comment. And in terms of political cycles, of course, right? Like the political conditions need to be in place for this to happen. And I guess like two things that have been successful in the past in the region. One is that when these tools have been used and have been successful, have been showing good results, more cost effectiveness than traditional funding schemes, that especially for ministries such as Ministry of Finance, is something that matters quite a bit, right? So that has helped, for example, in the case of Peru, where we have this RBF model that has been implemented for over around 8 years, but also many others that are being implemented in the country for more than 10 years, despite the changes in administration, is because of mainly the Ministry of Finance understanding the effectiveness and having some continuation. And then I think another kind of mechanism that is really powerful, and that's something that we have been doing more in Colombia, in the Colombian case, for instance, is having kind of a supportive environment of not only the government champions that have been using these tools, but also additional actors that stay over time, that don't have these administrative cycles, such as foundations or donors, right, like bilateral donors that stay. So building, let's say, coalitions and programs around these mechanisms that don't only have the objective of helping the government in the short term test these models, but also support them in using it over time, right? Like bringing more capacities, evaluating, documenting, and regrouping new government stuff when there's changes has been really, really key. So I think those are some considerations.
Great, thank you, Sigrid. There's a couple more questions in the chat for you, but given the time we have left, I'm gonna pass on to Martin, who's gonna present to us some of the results and the learnings from the Plan Nacer, and then we'll move on to some questions for Martin. So Martin, the floor is yours.
Thanks, Maria Laura. It is my pleasure to be part of this very interesting session. Let me share my screen, please. Can you see my presentation?
Yes, yeah, we can see it.
Thanks. Thanks so much. So, well, I will talk a little bit about Plan Nacer and Programa Sumar. It is the same program. I would say that Programa Sumar is the expansion of Plan Nacer. Some basic features about the program. As you know, Argentina is a federal country, and the Ministry of Health, the National Ministry of Health, plays the stewardship role, but the provinces are in charge of ensuring access, health access to their population. So in our country, we have a great challenge in terms of coordination of policies. So the main purpose of Programa Sumar and Plan Nacer was to increase access to healthcare services, specifically for a subset of prioritized services for people without formal health insurance, by strengthening the purchasing function through a twofold RBF mechanism. Then I will explain this main feature of the program, that is the RBF mechanism. We started after a profound political, social, and economic crisis in 2001. The program, it is about to be implemented for 2 decades. And well, the beneficiaries, we started with only 9 provinces covering 700,000 people. And today the program is covering the whole population without formal health coverage. It is around 20 million people. And the program is reinforcing the access and quality for more or less 800 health services. And here you can see the twofold RBF mechanism. We have 2 relationships. The first one, it is between the federation and the provinces. In this case, the national government uses a capitation payment linked to results. 60% of this per capita payment is transferred every month, and it is linked to the enrollment of the target population, but at the same time, to confirm that each beneficiary, each enrolled beneficiary, has received at least 1 preventive service in the last 12 months. And the remaining 40% of this per capita payment, it is linked to to the achievement of health outputs and outcomes, and that are measured every 4-month period. And in terms of outputs, the program is measuring, for example, early detection of pregnant women, follow-up of healthy children, immunization coverage, or the prevention for some prevalent cancers. And in terms of outcomes, for example, the program is evaluating the survival of premature newborn babies at 28 days of birth. And well, the provinces receive those resources, and they can only use that money to purchase a health benefit package, these 800 services, and they must use a complementary payment mechanism, because the main source or the main mechanism to finance or to fund the public network is a budget. So in this case, with the resources of Programa Sumar, they can purchase this health benefit package. They have to enter results-based management agreement with each health center, with each public hospital, and they can purchase those services using a fee-for-service mechanism that is linked to preventive services, and a per capita payment that is linked to results. And another key feature is that for the first time, health centers and hospitals have autonomy to use these funds in order to cover their local necessities. And this is critical to close the incentive chain in these 2 relationships. And it is important to highlight that all results, all rules are audited by an external auditor. This external auditor is an independent auditor, because they are in general private firms, and these private firms is mandatory. Their decisions are mandatory for the provinces, the federation, and the facilities, and they can apply, the external auditors can apply sanctions, financial penalties, for example, debits and fines, when they identify inconsistencies between what was done and what was reported or what was rewarded by the nation or by the provinces to the facilities. And well, through these intergovernmental transfers, the federation in Argentina is following many purposes. For example, the introduction of a common health benefit package in all provinces that placed the focus on primary health care. It is an excellent tool. It has been an excellent tool to equalize funds and to create incentives that are aligned to health goals with a focus in poor population. It has strengthened the purchasing function within the provinces. It has eliminated out-of-pocket payments for those services that are included in the benefit package, and it has broadened the financial autonomy of providers. So how does Programa Sumar encourage behavioral changes? Well, of course, using financial incentives to the provinces, placed at the provinces and facilities with transfers and debites. Some provinces allow their facilities to pay bonuses for their staff, but at the same time, through the empowerment of health teams with an increased autonomy, improving their work environment, providing new training opportunities, specifically on health management, incorporating new tools like performance indicators, regular auditing and supervision visits, doing strategic planning, and with a strong leadership, specifically regarding this aspect of defining long-term goals, that these payments and these transfers are reliable for the provinces, are reliable for the facilities, defining core rules, but then giving a wide autonomy to the provinces and to the facilities so they can adapt these national definitions to the local reality, and promoting a bench learning dynamic between provinces and between facilities. So some achievements, institutional achievements that have been observed in the provinces and the facilities with the contribution of Programa Sumar, that let me say that represents less than 1% of the average provincial health budget. So with very little money, with only 1%, we can say that Programa Sumar has strengthened 100% of the public system, because it has provided the federation with stronger influence over the provinces and has facilitated this intergovernmental coordination and dialogue. This was very important, specifically during the pandemic, to develop a concerted response between this level of governments. It has initiated the agenda for developing the strategic purchasing function. The RBF or PBF is not a perfect payment mechanism. Today, all health systems are trying to combine to create blended payment mechanisms, because every payment mechanism has advantages and some limitations. Then we have to distinguish between inherent limitations to limitations associated to how well it was designed, or how well it was implemented. Remember that at the health system, we have, for example, for each health center or for each health hospital, we have multiple principals for the same agent. So we are a very fragmented system. So sometimes you can design in a well-shaped this PBF instrument, but it can be neutralized by other instruments that are being implemented at the health system. So continuing with these contributions, the program has created the culture of data digitization in the public system. It has developed the first federal roster of people covered by the public system, and it is the richest data asset that enables real-time monitoring of health service utilization at the provinces, at the municipalities, and at the facility. It empowered public providers, as I said, to play a totally novel role. And this is very important because the program has been encouraging a bottom-up innovation culture. It is impossible to transform the health system without empowering health workers. So this was a key characteristic of the program. It is still a key characteristic. It has introduced new tools and management modalities, performance agreements. It has incorporated an explicit benefit package. Sometimes in our systems, the roles and the specific responsibilities are not clarified. So these management agreements between the national government, the provinces, and the facilities, it is very useful in this sense. And as I mentioned, it played a key role during the pandemic. I incorporated this slide. It is not in English, but in order to improve the generation of data, the quality of data, the utilization of data, to transform data into actionable knowledge, it is not only about incentives. Incentives can play a key role, as Programa Sumar played here in Argentina. But Programa Sumar was this. It is like the incentives placed at the right place, that are the health centers, in order to capture, collect more data, timely data. But then to develop a more comprehensive data culture, to take advantage of this data, you need a more comprehensive approach, trying to create incentives, create a new culture by training people, by putting data to work, because today I would say that there's a strong underutilization of data. We are data rich, but information poor. But it is not enough with these actions. It is important to develop the infrastructure, to develop the infrastructure, specifically defining standards. One key decision that made Programa Sumar was to define standards to incentivize the collection of prioritized data and to support local instruments, because in our country and in health systems in general, there is like silos, information silos. There are multiple information systems within the same facility, and of course this prevents us to capture more data and to incentivize in a better way providers. I am just finishing, and well, we carried out some impact evaluations here in Argentina, and we did 3 impact evaluations with the support of the World Bank, and we found very positive results, specifically in the North region, that is the most underdeveloped region. And well, there was a reduction in neonatal mortality risk, a high reduction. We found a reduction of low birth weight risk. The program has also increased the early detection of pregnancy or the follow-up of pregnant women. So I am basing my comments and my reflections about Plan Nacer and Sumar not only regarding this certificate of effectiveness, that is the impact evaluation. I am basing mainly my comments and my reflections on my experience working with provinces and working with facilities. And well, if you want to know more about the program, here I quoted some papers that you can find in the links that are mentioned in the PowerPoint. Thanks so much.
Thank you very much, Martin. That's an excellent presentation, and you've touched upon many points that we were discussing with Sigrid, and I think that this is one clear example, a successful example of when an initiative can not only permeate one government administration to the other. This program has 20 years of life, and it has continued to expand. And the question related to that is, well, Argentina already has a successful example of managing to get government buy-in from different administrations to take this program forward, to change, as you clearly said, the culture of administration, the culture of, in this case, the health workers on how they work, the culture of how budgets are passed on from the central government to provincial government, and from the provincial government to the different health outlets in the provinces. Do you see that this is transferable to other areas where a results-based financing scheme could be used for, like education, like unemployment of underprivileged youth, and so on? And a question related to this is, the Plan Nacer and Programa Sumar have managed to permeate from one government to the other. What would be your advice for other individuals that are in the room today that are maybe struggling to work with their governments to get that essential buy-in in order to get this continuity and this long-term view for a program of this nature?
Okay, yes. Well, I think it is very useful for other sectors. It is demanding in terms of management dynamics, and this financial reform is mainly a managerial reform. So, but I think we started 20 years ago. Our capacities were lower, and this tool was the key enabler to develop a new managerial culture at the national government and at the provinces too. And it helped us to boost like a silent reform. We know that we need to transform our system, and the pandemic emphasized this aspect. So through these kind of mechanisms that are demanding, of course, it is easier to start transforming many components of a health system. And I think you can find the same contributions in other sectors as well. And in order to sustain or to institutionalize these instruments, well, it is critical. Well, you have to do many things. You have to develop an evaluation agenda. You need to empower provinces, you need to empower local authorities and health facilities, because today the program belongs to facilities, belong to each health worker that that finds in Plan Nacer the opportunity to better deploy his or her vocation. They feel that they have better possibilities to work well and to better respond to their patients. And I think that the most challenging thing is that you need to sustain the conditions for its permanent evolution. It is not only sustaining like an old picture of the program. This kind of programs needs to evolve all the time. And for doing this, it is very important to have a strategic vision, but to have skillful teams, not only in our case, not only at the national level, but at the same time at each province. But the good news is that through this kind of program, it is possible to start. It can act as a tool to guide a managerial change at each provincial or national ministry. So, well, I think in other provinces in other countries, this is a very useful, interesting tool to boost a transformational process. But of course, it has to be part of a coherent and a comprehensive plan. It cannot act as an isolated instrument. It will be neutralized by many other factors that are placed or are at present in our health systems.
I think that you've touched upon so many interesting points, but I think one of the richest points that you've touched upon is the use of data, and the fact that data richness doesn't mean that we have enough information or good information. And I want to extend an invitation that we do another session where we dive deeper into that particular issue and into Plan Nacer and other examples from around the world to unpack that in a little bit more detail. I'm conscious of time, and I would love to go on talking to you, Martin and Sigrid, but if you accept the invitation, we do a double click on the issue of data, which is key, and onto how to leverage on that to build on these programs in other areas of either education and employment, etc. And I will pass on to Mara now for a wrap up, if you don't mind.
Yes, thank you so much. Yeah, it's such a rich conversation. We can, I would encourage you to reach out to our speakers to keep the discussion going. I just want to make a quick highlight for to pick up on the points from Sigrid on making the evaluation accessible. When we know those evaluations, we are trying to link them on our data set. If this evaluation that you mentioned, please send it to us and we will upload, because we agree having a single point where you find the information is really, really helpful. And I also want to highlight that we are coming through a global systematic review of various outcome-based approaches, not just impact bond. And those are papers where there is an empirical evidence, quantitative or qualitative, on the use of these approaches. And we will post them. It's a big job, but in the coming years, we will post all these studies. We'll try to synthesize them and link them to a data set that is not just impact bond, but also this project. So much to come. And thank you so much, Martin, to highlight the importance of having a plan of how do we change the culture beside running a particular program with a particular financing instrument. I want to close thanking everybody and inviting you to our next peer learning session, which, do we have a slide, Juliana, on the next peer learning session? Is still on Latin America and will be a deep dive on a project in Brazil. And the session will be on the 18th of August. Check online, or we will invite you, and we will look at the Brazilian case. This will be an impact bond. But another invitation I want to give you is remember to register for the Social Outcome Conference in September, the 8th and 9th of September, to continue the conversation. And I conclude here. Sorry for overrunning a minute into your day. Thank you again to all the speakers and all the great questions in the chat. Sorry we couldn't come to all of you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Thanks, bye-bye.